And now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Of course, spring is in full swing, but that also means that allergies from all the pollen in the air.
In fact, here in Korea, tree pollen from oak and birch trees, along with those from weeds like mugwort and ragweed, are the main causes of seasonal allergies. Now, to find out how we can deal with what is an annual nuisance for many, including myself, we connect with Lee Hyun-joon, Vice President for the Society of Sports Korean Medicine and a Doctor of Korean Medicine. Thank you very much for joining us today, Doctor.
Hello, good morning.
And well, first of all, we use the term allergies or just seasonal allergies as a very overarching term, but specifically, what conditions or illnesses may be caused by pollen in the air?
Pollen in the air could cause some severe illnesses with your respiratory system in some people during this time of the season. Many of us are exposed to the pollen, but not all of us show allergy reaction to it. And about 10 to 20% of population are known to have allergies to the pollen. And pollen alone can cause illnesses such as allergy rhinitis, conjunctivitis, dermatitis, and asthma. Common symptoms you can experience is runny nose, stuffy nose, or itchiness in your nose or in your eyes, or even in your skin, and sore throat, and sometimes difficulty in breathing. When pollen is mixed with the microdust or yellow dust during this time of the season here in Korea, it can worsen your symptoms. So those who are allergic to the pollen should pay extra caution whenever you plan to do outside activities. So be sure to check the air quality index before you plan to go out and do outdoor activities. And sometimes wearing masks can help you from avoid the pollen from affecting your respiratory system.
Guess it's going to be pretty tough when the outdoor mask mandates are lifted by next week. But kind of curious, how is seasonal allergy sort of diagnosed in Korean medicine? And also, personally for me, I seek Korean medicine when, let's say, I have back pains or so. But do Koreans seek the more traditional medicine over Western medicine when it comes to treating seasonal allergy as well?
Well, diagnosing the seasonal allergy is not quite different from the Western medicine. We take the history of patient symptoms, and we could use intranasal endoscopy to see the condition of the nasal cavity of the patient. Sometimes we can request the blood test to see the numerical value of immunoglobulin E, known as IgE, which is one of the indicators for allergy illnesses. And in the Western medicines, the patient will be normally prescribed with the antihistamine pills or steroid sprays to suppress the overreacting immune system. But these would not work well with all of the patients. So there are many patients coming to Korean medicine clinic to cure their illnesses. Many people are exposed to the pollen during this time of the year, but not all of them develop allergy symptoms, and this reaction can vary from person to person according to their underlying causes. In Korean medicine, we try to regulate and enhance the immune system of our body using various treatment tools depending on your personal body condition.
And Dr. Lee, so in what ways are seasonal allergies treated using Korean medicine? And could you also tell us about some pressure points that we can use to alleviate the pain as well? Sorry, the symptoms as well.
Okay. In Korean medicine, seasonal allergies could be treated with various treatments, such as acupuncture or pharmacopuncture, moxa or chuna manual therapy, and herbal medicine in order to elevate the symptoms. Many patients are prescribed with the herbal medicines according to their conditions, and there are also commonly used acupoints around your nose and these points are effective in allergy rhinitis. Today, I will introduce some of the commonly used acupuncture points to treat this allergy disease. And the first point is called indang, and indang is found on the face, and it is located at the glabella, the midpoint between the inner ends of the eyebrows. It's right here. And the second point is called Yeonghang. And Yeonghang is located in nasolabial sulcus at the same level with the midpoint of the lateral border of the ala of the nose, next to the nostril.
So it does seem... Go ahead, doctor.
Okay, so for those who have a busy life and not able to go to the hospital, maybe pressing down these acupoints or just tapping on it could help you relieve your symptoms a little bit.
All right, it does seem pretty simple there. Now, we do apologize to our viewers. We seem to be having a bit of a technical difficulty with the videos, but we did get, I guess, the good gist of where the pressure points to kind of press if you do go through this. But Dr. Lee, also diet is very important when it comes to treatment of any kind of illnesses. So is there any kind of food or drinks that you would recommend for some of our viewers who do go through on a yearly basis the seasonal allergies?
Well, seasonal fruits and vegetables have rich vitamins and antioxidants, which can help with your immune system. So try to eat plenty of seasonal fruits and vegetables would really help. And one of my favorite remedy is mixture of citrus and ginger and honey. And our circadian rhythm changes from season to season and from time to time on the daily basis. And our circadian rhythm reaches the lowest point of body temperature of about an hour or two before you get up. So whenever you get up and try a day with a hot tea of citrus, ginger, and honey is a good way to increase your body temperature and enhance your immune system. So I think it's one of a great methods to start your morning life.
Well, your remedy sounds delicious, Dr. Lee. Ginger, a bit of lemon maybe, and honey. Well, I'll definitely be trying that and also tapping away at my pressure points. Thank you very much for your insights today.
Thank you. Bye-bye.